work in an NGO as a mental health CS community support worker, and the skills that I bring to work are the same as the skills that a health assistant has in a DHB setting, a ward setting. I don't see why I should be paid less than them. I have as much responsibility, if not more, than a DHB person, a health professional. We don't know what we're going to come up against being in a mobile support person from day to day. Our clients change their moods from day to day, especially within this drug-infested community that we have in West Auckland. And that's a sad reality. There is a lot of drugs, and the so-called legal drugs that have proliferated around the countryside and keep popping up as soon as every time one gets banned, another one comes out, and our mental health clients just seem to gravitate towards the next drug, the next high, and we are left to try and sort them out afterwards. So it's a very dangerous position we have at times, and we don't have the same sort of backup as a inpatient unit person would have.
Where I work, we've got community workers, or kaiawhina as we call them, who go off and they do training, and their wages don't ever increase, and the only, sadly to say, increases that they've gotten over the years is for whatever PSA has bargained for our collective. And they get disheartened about going to do training when they're not going to be rewarded to going off and doing those trainings.
I find where I am now, we are left behind, and the males go higher. Even with our training, we don't go anywhere. I've been on the same rate going on for 6 years, and yet I have the same qualification as our male colleagues. But they just kind of ignore us, and because we want to work and we need to work, we just have to suffer and go with what they have, what they give us.
Yeah, and I'm working in the mental health sector. I feel that I'm underpaid. I'm actually working alongside my team leader, which they class me as a PA. I'm the only one there running and making sure that everything's running smooth and taking care of everything, but also got the most clients out of my team members, and also doing a lot of the clinical work now for clinical, and yet not getting the same pay as clinical. So just feel that being underpaid for the work that I'm doing, undervalued for what I'm putting in, and also dealing with males that are in highly needs, and medication also, which I'm not a registered nurse, but I'm there to also observe it and make sure that medication is taken. So feeling very much underpaid for the amounts of work that I'm doing, and undervalued, and at the end of the day I'm it because I'm my boss's PA.
As a home support worker, we're classed as assignment workers, and we're not given 8-hour shifts. We're given, like, we might have 1 hour's assignment with one client and perhaps 2 with another client, and we could work 3 hours one day, we could work 5 the next day, and if anything happens to the client, that they die or they get sick and go into hospital, our hours are cut. There's no continuing of the assignments, and there's no guarantee that our employer can give us replacement hours. So we're vulnerable in that we don't have security of wages. We don't get regular wages every fortnight. It can vary drastically, and when you're underpaid and undervalued, it just adds considerable stress to day-to-day living.
We're going to be losing our sleepovers, so we're only going to be on contracted hours, and that's not going to give us much money to live on.
Family members trying to fit their shift work hours, especially a resident, around their family members is quite tough. So they've got to take either annual leave, sick leave, and if they've got no leave left, then you know they miss out on a full wage. So it's actually getting quite tough for some of the staff members that want to work, but the shift work that they've been put on, they can't do it because of their family members at home. So it's they've addressed it, you know, to the bosses, but you know, it's because they are supported hours and that's their contract. So, you know, they've got nothing. They feel, yeah, that they're undervalued. They don't know what to do about this.
I've got an 18-year-old who's just graduating from college and going through the process of looking into seeking work and getting the help that the government has available. So it's interesting seeing that process in terms of just some of the things that she has to do, and she has no idea what they are, but she has to do them first before she even gets to the assistant part. So that's been kind of very overwhelming for her as an 18-year-old person. And also my son, who's about 22 years old, had to take on a Hannah's retail work, and he's found that it's not quite what he wants, but he has to do it, and he has no idea of his rights. And he talks about some of the measures he has to meet, and it's just interesting that, you know, and for my kids, I realize that they're actually walking into a working environment without clear understanding of what their rights are, what they can negotiate, and who to seek help from. So, yeah,